Hi, I'm Gale Brewer, Manhattan Borough President, and I'm here with Represented NYC on Manhattan Neighborhood Network. And I hope that everyone has a safe and healthy 2021, and you had such a holiday that was similarly. We really have some wonderful guests, and I'll introduce them in a minute, but we're going to talk about the topic that's on everyone's mind, which is the COVID vaccination. We'll try to explain with these fabulous guests how the vaccines work, who can get them and when, and why it is so important to everyone in the United States, if not the world, that a large percentage of the public get vaccinated so we can reach a level of herd immunity. We're going to take some questions at the end from New Yorkers who sent them into our office. Let me tell you about these two fantastic guests. First, I'm going to introduce Dr. Mary Bassett. She is a friend, and she is the former commissioner of the New York City Department of Health and Mental Health. And currently, Dr. Bassett is the Francois Xavier Bugno Professor of the Practice of Health and Human Rights, and she's the director of the Bagnall Center for Health and Human Rights at the Harvard T.H. Chan of Public Health. But I think one of the questions that people want to know, and you know this because of many years in public health, what is the difference between a regular vaccine, maybe like for measles or mumps or shingles, things that we've all gotten as children, and the kinds of vaccines that have been approved by the FDA, the ones that we hear about today, the Pfizer or the Moderna. So just to talk a little bit about the difference.
The first thing to say, though, is it should be really clear that vaccinations have been one of the miracles of the 20th century and remain one of the miracles of the 21st century. They were the reason that people survived childhood. And conventional vaccines, like the measles vaccine, are typically either a vaccine that's been made from a virus that's been weakened so that it doesn't cause sickness, or it's made from a killed vaccine, so it's not able to create illness in people. And sometimes it can be made of parts of the coating of the vaccine, because when we're infected, our body sees the outside of the virus or the microbe first, and it creates a response by its immune system. So by putting a virus into us that can't make us sick, but has the same qualities as the virus that does cause illness, our immune system becomes primed, so that when we encounter the virus, our immune system is ready to fight it. So we don't have to go through an illness where our immune system built up its ability to fight the virus. Our immune system's already primed. Now, what makes these two vaccines, the Pfizer vaccine and the Moderna vaccine, unusual is that they use a technology that hasn't been used on a wide scale before. They actually take the genetic material, the messenger RNA, it's a blueprint for a part of the virus, this novel coronavirus, that are clearly the immune system makes its key response to. It's called the spike protein. So it takes the blueprint, puts that into the body so that your body can make the protein, and therefore your body responds to this protein and makes its immune response. So it's not putting the actual viral particle or some part of the virus into your body. It's putting in the material that it has the blueprint for that spike protein, and that's new. And but it's not brand new. It's something that's been worked on by people worrying about the very old-fashioned techniques that were used to develop vaccines for decades now. So this coronavirus and the COVID-19 pandemic has accelerated a process that was already going on. It's not brand new in the past year. It's built on science that's been developed over decades.
So tell me a little bit more about how herd immunity, what does it mean, and how will that be part of what will help us keep everybody healthy?
The way all of us get infected with this novel coronavirus or any contagious disease is encountering it. If we have people around us who are immune, then we're less likely to encounter the virus. So that's what herd immunity is about. You can think about as increasing numbers of people are immune, they kind of create a circle of safety around people who are non-immune. And that's important because not everyone can receive all vaccines. There are people who have problems with their immune system, so they can't get certain vaccines, or allergies that makes the vaccines more risky. So herd immunity is something that protects people who are susceptible and not immune by building up a number of immune people in the population. Now, the only way that we have really gone after herd immunity is through vaccination, never through encouraging an infection to tear through a population. And the numbers of people and the proportion of people who need to be immune to achieve herd immunity can vary depending on how easily transmissible the infectious agent is. So the numbers that we've heard for herd immunity against COVID-19 have varied. They started out at like 2/3 of people, and now I think I've heard 80%, but it's large numbers of people either have to be immune through infection or immune through getting the vaccine. And the best way to get immunity is through getting the vaccine.
Or Dr. Fauci, whom everybody knows at this point. I love it that he's an older man and beloved, you know, that's my kind, right? But he's talking about 70%, and then he went up to 80%. So I think you're absolutely correct. Dr. Rosen, you're welcome to jump in. You're Director of Entomology and Surveillance at Department of Health in the Bureau of Immunization, a bureau that we all love. I think that Dr. Bassett knows it well. I know that the state has set some levels of prioritization, which of course everybody's emailing me about, but it's been between you and the state, it's certainly been listed as of yesterday and very helpful.
Sure. Well, since there's not enough vaccine available all at once for everybody, vaccine will be distributed in phases, and the CDC's Advisory Committee on Immunization Practices sets guidance for the country, and New York City and New York State's plan is based on these recommendations. So this approach to a phased distribution, it's rooted in equity, and it will prioritize people who have been hardest hit by the pandemic. In general, the people that are being prioritized first fall into one of two categories. So either people who are at increased risk for exposure to the COVID-19, or people who are at increased risk of having severe COVID-19 if they get infected. And so based on that, people who work in high-risk healthcare settings, like intensive care units or emergency rooms, and residents and staff of long-term care facilities were eligible to receive vaccine first, along with first responders and medical roles. And more recently, additional populations have been made eligible for vaccination, including most healthcare workers, medical examiners, coroners, and at-risk funeral workers, as well as frontline public health workers with patient contact. We expect that essential workers who can't physically distance and people who are at high risk of complications from COVID-19 because of either their age or underlying medical conditions will be prioritized next, though the exact details are still being worked out. But this phased distribution, it will take time, and we don't expect vaccines to be widely available until mid-2021. So people in the highest priority groups, they've already begun to be vaccinated, and we're so excited to announce that over 110,000 people in New York City have already received their first dose, but we still have a long way to go.
Well, the nurse that was the first to receive the shot got her second shot in the front page of the newspapers today. And I think that gave us, first of all, she looks like a wonderful person. And second of all, it gave us all a lot of hope. That was a great picture. But just along those lines, the papers today are just full of, what happens if you get one shot and then you don't get the second, and so on and so forth. I don't like that notion because A, follow the science. And second, I just worry that, some people will think that's it. And so how do you answer those questions, both of you, Dr. Rosen, this whole notion of we don't need to do the full complement?
Fortunately, both authorized vaccines are incredibly effective at preventing people from getting sick from COVID-19. Both vaccines do require 2 doses, either 3 or 4 weeks apart, depending on which vaccine you receive. And although there is likely some protection from infection after receiving the first dose, optimal protection really occurs 1 to 2 weeks after the second shot. And so the groups that have been prioritized for vaccine in the earliest phases are people who are at the highest risk for being exposed to the virus and for developing serious complications from infection. So we're making sure that these highest risk groups have full protection from 2 doses of vaccine by offering the second dose at the recommended time before expanding vaccine into the general population. But again, in order to get the optimal protection, you do need 2 doses.
Dr. Bassett, you might want to
Yeah.
comment on that also.
Sure. Now, I mean, the logistics of both of these vaccines are a bit complicated. So that is true. And the both of them so far, all of the vaccines that have been approved anywhere, and these are all so far emergency use approvals. They haven't been fully licensed yet. They all require 2 doses, and that's what you need to get in order for them to be fully effective. One of the concerns has been, what should we do? Should we hold back the enough supply to ensure that everybody who's had the first dose will have the second dose, will be assured that that's sort of in the bank, so to speak? And I think that that's been the principal strategy in this country, not to kind of go for broke and use all of your vaccine for the first dose, but to ensure that everybody who's been vaccinated should be confident that the second dose will be available to them. And it will be very important for people to get that second dose, because the protection after just 1 dose is not sufficiently high. These wonderful numbers that we've seen, 95% effective, is based on the 2 doses. And so to get that kind of protection, which is really a very highly effective vaccine, you have to get the 2 doses.
And I think also the other issue for Dr. Rosen is there are people even in the nursing homes who are opting out. I think what Dr. Bassett said is there are going to be people who either opt out or for other medical reasons don't take the vaccine, and that's why we have this herding situation. We need to get to a certain percentage. So how do you handle, Dr. Rosen, even in the nursing homes where people are opting out, or just even the general public? Is it just a constant, like that wonderful nurse who said, I've got it and I'm doing fine? Is that kind of the way that we go about it, or is there any other strategy for those?
Yeah, it's a great question. And I understand that many people have concerns given that this is a new pandemic and it's a new vaccine. So we at the health department feel that it's important to be transparent about what we know and what we don't know, both about COVID and the COVID vaccines. So we know that the current vaccines have been tested in tens of thousands of people in clinical trials, and they were found to work incredibly well at preventing people from getting sick. And importantly, no serious safety concerns were identified from the clinical trials. So these clinical trials, they were held to the same rigorous standards to make sure that vaccines are safe. And volunteers who were included in the clinical trials were from diverse populations. More than 30% were people of color, and many people over the age of 65 years were included. And the vaccines were found to be highly effective and safe across all race, ethnicities, and age groups. Because the clinical trials were shorter, we don't yet know how long protection from the vaccine will last or whether additional doses will be needed in the future. We also don't know whether the vaccine will be safe and effective for children under the age of 16 years, since studies in children have not yet been completed. But we can reassure everybody that the COVID-19 vaccines are free for everyone. The vaccines are available to people of all immigration statuses, and vaccination is not a public benefit under the public charge rule. And when people receive vaccine, their privacy will be protected.
Okay, and we're going to in New York, I don't know if this is true around the country, but we're going to be doing 24/7. In other words, 7 days a week, 24 hours a day in certain locations. Is that going to be something that's happening? Because that could up the 110,000 to many more in the near future. Is that how it's going to work?
Plans are still underway for how people will be getting vaccine once it's widely available, but we can anticipate that once it's available to the general population, people will be able to get the vaccine at all the same places where they currently get their flu vaccines. So for example, at pharmacies, urgent care centers, their primary care provider, at community-based clinics, and through outreach from the Department of Health.
So I think I just have to come in and put on an old-fashioned public health hat and remind everyone that the ways that we know to protect ourselves still hold true. And that as we wait for the vaccine production to meet the requirements of the population, and as we roll out and develop the capacity to deliver the vaccine to everyone, we all need to remember that keeping our distance and avoiding indoor spaces, wearing face masks, staying home when we're sick, and all of these actions that all of us have become exhausted by do work. And we need to remember that they are an important complement to the vaccine, even as it rolls out in the population.
And what about this issue of the other strain that seems to be in 30 countries around? One, according to the papers, there's an upstate person who has developed this strain. When I have asked people at the department, it's my impression that this vaccine works for this strain also. But I just was wondering, Dr. Rosen, is this something that's of concern in New York City in terms of the spread, obviously, but also does the vaccine work for this strain?
So this is something that's being evaluated at the local and federal level. And so there's still a lot to learn, but the thought is that it is very likely that the vaccine will protect against this strain. But again, these are evolving situations, and we're still learning every day.
I know we're trying to figure this out. We don't know how long the vaccine is going to protect us, but do we have some sense of if in fact the country, or in our case, New York City, I'm just guessing by the end of 2021, those who will be vaccinated are vaccinated. We have a herd immunity, perhaps, at a certain number. Is there any guesstimate as to when this might be? I'm just making up the end of 2021. Or is this something that is still being discussed? Or how do, people are, I get my vaccination, but then what? They're just, it's so many unknowns, Dr. Rosen. I don't know if you can address that.
Sure. Well, it really depends on a lot of factors. It's a $1 million question, but as Dr. Bassett said, in order to get where we need to be, we really need people to continue to wear masks and distance and stay safe, in addition to getting vaccinated. And our goal is that if people continue to do that throughout the course of time while people are getting vaccine, we hope that once there's high enough vaccination coverage, that we can begin to reduce some of these measures. But as a reminder, we still have a lot of questions. For example, how long does protection from the vaccine last?
Is there anything to learn about other countries? And is there anything to predict for other vaccination companies, pharmaceuticals, coming up with anything that is different, better, similar in the future?
Well, that's a really great two-part question. Obviously, a concern exists about the ability of poorer countries to vaccinate their populations. And I'm hopeful now that we'll have a new regime in Washington that there'll be a return to multilateralism. If there's anything that shows us that we all need to be safe in order for each one of us to be safe, it's a global pandemic. So the whole issues of affordability of the vaccine and access to the vaccine by developing countries is one that that the World Health Organization is urgently addressing, and that's part of protecting ourselves. The other question was about the pipeline, and Dr. Rosen may have more up-to-date information, but there's something like 60 different vaccine candidates in active clinical trials. So it would be great to have a vaccine that didn't have such onerous requirements in terms of keeping it cold, and was more stable once it was thawed, and didn't need to be given in 2 doses. And it's possible that we'll be able to, we will have a vaccine that has those qualities. But right now we have a highly effective vaccine that protects people against against severe disease, and that's a great first step. But there's a lot still to come.
So now we have some questions. I think that the folks are going to ask, these are regular New Yorkers who've got questions for Dr. Rosen. I think the first one is Reverend Chloe Brewer.
Hi, my name is the Reverend Chloe Brewer. I'm here in West Harlem with my family, Clara and Ansel, who are over there, and my husband, Greg, who is in line further up. We're trying to get tested for COVID. And here we are, 9 months into the pandemic. It is a 3-hour wait on the sidewalk to be able to get tested for the same day. My question is, when is New York City's government going to do something about this so we can end the pandemic and have something that is equitable, and quick for all? Thank you.
Once the vaccine becomes more widely available to the general public in mid-2021, there will be many options for places where they can go to get vaccinated. So people will not all be relying on the same location. And these include the same places where people currently go to get their flu vaccine. So that would include medical practices, pharmacies, and urgent care centers. In the meantime, there are currently several mechanisms in place to try to reduce wait times for COVID vaccine. In some settings, for example, appointments will be available, and facilities are being encouraged to screen patients for symptoms before arrival at vaccine sites to save time and avoid exposures where possible.
I think she's also talking about testing in addition to vaccine. So the testing will continue. I mean, it is confusing for people. So the testing will continue at the same time that the vaccines are being rolled out. Is that how it's going to work?
That's correct. While there's still COVID infection, there will continue to need to be COVID testing.
And I think what she's stating is that as that rolls out in terms of the vaccines, we still have to try to get the testing to be as easy as possible also. I mean, I know it's not, we all wait in line, but what she's stating is it's hard because the medical facilities are stretched so thin. You've got testing, you've got vaccines, you've got flu shot, and you've got just every other medical challenge. But I think what we're saying is, the lines for the testing don't make people want to get tested.
Understood, and that's something that we are well aware of and trying to address. We agree it's an important issue to address.
What are the side effects of these vaccinations that we're being given to help fight COVID?
Most people report some mild to moderate side effects from the currently authorized COVID vaccines. And it's important to understand that these side effects are usually normal signs that your body is building protection, that your immune system is working and the vaccine is working. And common side effects include soreness or swelling in the arm where you got the shot. Many people have had headaches, body aches, and tiredness. Some people also have a fever. Side effects usually start within the first 3 days after getting the shot, the day after vaccine being the most common. And side effects typically last about 1 to 2 days after they begin. The studies have shown that side effects are more common after the second shot and maybe more common in younger adults. But it's important to note that if your symptoms get worse or don't resolve after a few days, you should contact your provider.
Hello, Manhattan Borough President Brewer. My name is Nye Whitaker, and I'm a proud resident of East Harlem. The question I get the most from my neighbors is, how do you know of an approved or authorized pop-up center if you are walking down the street or on your way to or from work or school and you would like to take yourself or your family to get tested? And how do you avoid being scammed? I have a neighbor who went to a pop-up site that they thought was offering low or kind of low cost or no cost testing, and later received a bill for over $700. How do we make sure that in our community, which already has some mistrust of the healthcare system, that our residents and our neighbors are going to the right place to get their test for them and their families, are able to get the results, and are able to do so in an affordable or no-cost manner? Thank you.
There will be a vaccination site locator map on the health department's website, so please stay tuned for more information on the website. And also, as mentioned, once vaccines are more widely available to the general public, you'll be able to get vaccinated at the same trusted places where you would get your other vaccines, like the flu vaccine. And so that would include places like your primary care provider and local pharmacies, as well as community clinics. And also the Department of Health will be setting up community vaccination sites. So the vaccine will be free for everybody. It is free for everyone. If you have insurance, it may be billed, but you will not be charged a copay or any other fee.
I mean, that's helpful. I know that not everybody has a provider, not everybody has a flu shot, and not everybody has somebody to call. So the more that the Department of Health can do to say this is legitimate. I also want to just thank the department, because I know that people who are blind or visually challenged have also asked for support, and you have been given the right to do vaccinations to the Lighthouse Guild, which of course is a wonderful organization that works with this population. So I just want to say thank you. And I hope that what we have said to the listeners and the viewers of Manhattan Neighborhood Network, and I want to thank them and thank you, is that there is a great deal of positivity coming out of this vaccination, 2 doses, and that there is a need to have a herd immunity, and that is it's a very safe and a way in which we can be healthy for the future. But as Dr. Bassett said, keep wearing your mask, keep being socially distanced, keep washing your hands. And, we will work with the City of New York and the Department of Health to make sure that we have enough places that people can get vaccinated easily. Anybody who wants to get information on the Manhattan Borough President site, you can do that. It's just www.manhattanbp.nyc.gov. And we have a newsletter that people think is fabulous. So you're all welcome to sign up and subscribe. And thank you both very, very much. This is such an important topic for our future and for the constituents and residents whom we all love. Thank you. Thank you, Manhattan Neighborhood Network.